My name is Dr. Goran Jezic, and I'm the medical director at Houston Hair Transplant Center. I went to medical school at the University of Texas Health Science Center in Houston, and I did my internship there as well, followed by specialty training at the University of Utah in Salt Lake City, and I've been practicing in Houston since 1996. I think that the thing that really attracted me the most to hair transplant was just the ability to help patients on a level beyond sickness and health, but more just generally feeling great about themselves, even psychologically, just helping their overall well-being. Really, we're able to enhance patients' appearance in a broad realm of situations. I have patients with advanced hair loss that really need as much help as possible, and then the other end of the spectrum are even very subtle cases, everything from newscasters to male models, professional athletes that really just want a subtle touch-up, and then of course some sadder stories of abuse or trauma. Hair loss, whether it's traumatic or genetic, can be devastating to patients psychologically, so it's extremely rewarding to help people with that. I try my hardest to have a very personal approach with patients. The initial consultation is performed entirely by myself. I will sit down typically at least 30 to 45 minutes with a patient one-on-one, face-to-face, to discuss their medical history, any potential medical issues, then to sort of establish their hair restoration goals, establish realistic expectations and parameters, also get into the artistry where we'll sit in front of the mirror together and I'll take a wax pencil and draw the hairline, and we brainstorm and come to a decision together, the patient and the doctor, of what's going to meet the patient's needs. So I take extreme pride and value in that, because I believe that that's what sets my practice apart. It's not a sales pitch, it really is more of a medical consultation with the goal of providing as realistic expectations as possible. The most important thing for me is that my patients feel comfortable with me on a personal level. Ultimately, I believe that the most important single element in the doctor-patient relationship is the patient having confidence and trust and a comfort level with me personally. People comparison shop, and so if it all boils down to where the price is more or less the same, I think ultimately the decision maker is which doctor does the patient feel most comfortable with. Again, I can't emphasize enough that this isn't a sales pitch. This is really an effort to establish a doctor-patient relationship and to give my patients confidence that I'm going to be able to help them with their hair restoration needs and objectives in a realistic manner with as little downtime and discomfort as possible.